Hi guys, today I'm talking about the NHS, hot topic at the moment. Basically it was started by a man called Bevan. He's a lovely Welshman. It was proposed in January 1948 and it was to be put through in July the 5th of the same year. That's 6 months to start up a national health service. There was a lot wrong after the Second World War. Bevan, the Health Minister, faced a lot of opposition, mostly from the Tory party, which at the moment is trying to privatise the NHS. Britain was basically bankrupt after the war, and the NHS was said to be a free-for-all, and not what everyone knows it is. It's to draw a line between the disparity of the rich and the poor. It was actually opposed by doctors, surgeons and dentists. They said it would rob them of their independence and freedom. Now, 1947 had been the coldest winter since records had began. People couldn't afford their heating, sound familiar? And they were scared to be sick. They were scared to have the time off work, so illness went untreated. There were women suffering prolapsed wombs after childbirth, and the nation had very sick children. They suffered things like diphtheria, TB, measles, and this basically led to their mortality or death, which is terrible, but it's the way things are going right now. There was such a high mortality rate, and the children that did make it to grow older, they suffered illness, they suffered rotten teeth and brittle bones. And there was a massive flu epidemic after the First World War that killed off a lot of people. Back then there was about 1 GP per 18,000 people in the poorest of areas, and in the suburbs there was 1 per 250 people. The priority in that time was money over the medicine. It's starting to go that way now with privatisation. And Bevan had lost his father through a mining related illness that caused him to have a disease of the lungs. It was a war for social change, and I believe that that's a war that a lot of us are fighting right now. Even Churchill opposed this strongly from the very start. You can see all the history of this in a documentary called The NHS, A Difficult Beginning. It's so informative, and it will make you realise what a national treasure it is. Now, as far as today goes, privatisation is the buzzword. It's not the cure. There was actually a staff survey of the people who work at the Hinchinbrook Hospital, and they are finding it one of the worst places to work. This is information that is available on the internet, on Google. Make your tax money work for you. Now, any qualified provider can bid for an NHS contract. One of the biggest at the moment is an actual arms company. I learnt this on Russell Brand's The Trues. I don't know what will be next. Weapons testing on the elderly. You don't know these days. Do we really want people profiting from illness? No, you don't want people making money off of your sick mum or dad or sister, auntie, uncle. And the people who stand to gain profit from this are actually the Tory parties themselves, who, if you remember, opposed it in the beginning. There's not enough staff already to run the NHS, and they've already axed 7,000 nurses since the privatisation.